All right. Hey there. Good morning, everybody, or good afternoon by this point. Thank you for joining us here today. Quick introduction myself and my colleague here that are hosting this event today. My name is Estevan Garcia. I am a multicultural engagement coordinator with NAMI Delaware, and my colleague here.
Hello, my name is Jacqueline Contreras. Also multicultural engagement coordinator with NAMI. Here also from NAMI staff, we have Jim Ford and Wes. Thank you guys so much for supporting us.
Yeah, thank you all for joining us here today for this important discussion. So I guess a quick introduction of what we're doing here exactly today. So sometimes we find ourselves in search of different services, whether they be medical needs, mental health services, or general resources. And we may be under the impression that there are just no resources. Sometimes we might just not know where to look. And speaking on Sussex County specifically, things may feel a little spread out sometimes. So today we have members of some organizations in Sussex County that are here to talk about some of the services that they provide. We're holding this panel discussion today in the hopes that it may be helpful to someone that is not familiar or maybe just needs some direction to receive some of these services. So real quick, let me go down the list here. We have joining us today, Erin Willis from Sun Behavioral. She's the Director of Business Development. Mikhail Wint is the site manager at the Bridge Clinic. John Russum, the behavioral health administrator for Lored. Bonnie Winchester, peer recovery specialist at the A Center. And Janet Yeridol, the executive director at Addiction Medical Facility. So let's get right to it. Let's see, I guess we'll begin with John, if you can join us, please. So you may have heard of Lored and may be familiar with some of their medical services. Today we'll be talking about some of their services, including some of their mental health and recovery resources. So John, if you'd like to give yourself a quick introduction and if you could tell us, a little bit about Lored.
All right. My name is John Russum. I'm a licensed clinical social worker. I've been in this field over 20 years. I have been the behavioral health administrator at Lored for over a year now. Just a little bit about Lored. We are celebrating our 20-year anniversary. That includes primary care, dental, OBGYN, and behavioral health. Behavioral health was started 20 years ago by Dr. Capiro. He was the only provider at that time. Since then, we have grown to Dr. Capiro is still our consulting psychiatrist. We have 4 nurse practitioners. We have 6 licensed therapists as well. We do a number of different interventions here at Lored. We also have case managers. We have 2 currently that also help with the mental health and also the homelessness. Some of the things that we do offer here is one-on-one mental health therapy. We also have an addictions counselor here who does one-on-ones and also does group once a week that we do offer here. Currently, due to COVID, we've been doing the groups via meetings to go to make sure that everybody is safe. Currently, we are seeing about 3 to 4 patients per therapist or provider in-house. The rest we're seeing through telehealth currently. We're in talks with actually adding another telehealth provider as well. So we do have a lot going on here. We provide a lot of services for a large Hispanic Latino population that we have here in Sussex County. 2 of our therapists are bilingual. Our consulting psychiatrist is bilingual as well. I think as far as addiction goes, we do have 6 providers that are MAT providers, and we do prescribe Suboxone, Subutex, Sublocade, and Vivitrol.
All right, thank you, John. Let's see. I did have a follow-up. Do you provide do you provide services for specific age groups or like specific conditions?
And this is one of the things we do have a grant that tries to integrate services with primary care and with mental health. So we do see kids about 6 years old, all the way until we don't have any age at the end. So, you know, however old. And we do serve, again, like I said, a large Hispanic Latino population. We also serve a small Haitian population here in Sussex County as well. So we don't have, you know, I would say 6 and over.
Okay. And then real quick, for anybody that was trying to sign up, how would someone go about signing up with Lorette?
Okay. So what would you do would call 302-855-1233, and the extension is 1124. And you would get either our behavioral health nurse, Nikki, or our behavioral health medical assistant, Vanessa, and they would ask you some questions, and they would set you up for an intake if you hadn't already had one, and get you hooked up with a therapist and a prescriber.
All right. Well, thank you, John. I appreciate you sharing this information with us today. And, you know, I'm sure there's a lot of people that are going to benefit from knowing this.
Thank you very much.
Thank you. All right. Moving right along, we have Janet Yeridol from the Addiction Medical Facility. So would you like to give a quick introduction real quick?
Sure. So, yeah, so I'm an LCSW and a certified alcohol and drug counselor. I have been doing this work for 40 years and still extremely excited about it, as much today as I was when I first started.
Oh, that sounds amazing.
So, yeah.
Oh, I'm sorry. Okay, so I guess right off the bat, I wanted to ask, what is Addiction Medical Facility? There may be viewers, you know, who aren't familiar.
Okay, so the Addiction Medical Facility is an MAT treatment center, opioid treatment center. We do Vivitrol, methadone, buprenorphine, Sublocade, Suboxone, the whole range of those medications. We also do, if somebody wanted to just come here for outpatient counseling, we do that. You don't necessarily have to be getting medication from us. This is an integrated practice. We have a medical director. We have a nurse practitioner who does behavioral health and primary care. So if our patients want to have primary care here, they can. Our staff consists of drug and alcohol counselors and nursing staff, RNs, LPNs, medical assistants. Unfortunately, we do not have any bilingual staff here, but interestingly enough to me, we don't have any Spanish-speaking clients. I'm not sure why that is, but I would tell you that Addiction Medical Facility is probably one of the best kept secrets in Sussex County, because the more I get out to speak with people, the more I find out that this is a really unknown quantity in the community in terms of treatment providers, which is really unfortunate. But anyway, we are increasing right now. We have 420 patients in our clients in our service. So, you know, 66 admitted just since the 1st of April. So we're really increasing our capacity. And we do also do telehealth for both medical and for counseling. And that's about all I can tell you, Estevan.
All right, well, sounds good.
Well, started an interesting journey for me, I'll tell you.
Yeah. It's you know, it's great to hear that you're still excited to do what you do. And you know, hopefully this will help in getting that secret out there. You know. So I did want to ask, do you guys take walk-in clients, or do you need an appointment, or how does it work as far as signing up? Okay,
anyone can walk in here Monday through Friday between 5 o'clock in the morning. And yes, we are all here at 5 o'clock. Until 7 if you're coming for MAT. If you want MAT treatment, you got to get here between 5 and 7, because that's primarily when our medical staff is here. So if you want to get dosed that day, you have to come in, you know, preferably as close to 5 as possible. But if it was just, and people can also call in and make an appointment. Our number is 302-629-2300. And the front desk will answer the phone and would be happy to make an appointment for anyone. But you know, most of our folks come in as walk-ins.
All right, that sounds good. Is there any other last minute things you could think of someone might need to know?
We're closed on Saturday, which is kind of unique for methadone clinics. Methadone clinics notoriously have been open 6 days a week. we just recently, as of May 1st, we closed on Saturdays. This way we can give our clients medication for the weekend and they don't have to deal with coming in here on Saturday. We are moving towards more and more take-home dosing. You know, almost every case here is under review because, you know, people have had a lot of clean time. They have truly earned the privilege to take their medication home with them and not have to show up here every day. So.
All right. Well, Janet, thank you for joining us here today. And, you know, I hope a lot of people can benefit from this information as well.
Thanks.
All right. Now, moving right along, we're going to be speaking to Bonnie Winchester from the ACE Center. Hey, Bonnie, would you like to say a few words and introduce yourself to everyone watching?
Yes. Hi, Estevan.
Hey.
Trish was unable to make it, so I'm filling in for her.
Thank you for that.
I'm Bonnie Winchester. I'm a certified peer recovery specialist for Delaware. I currently am the program supervisor for Seaford. Trish oversees both Georgetown and Seaford. We are a peer-run center, which is a little more unique. That just means that we're not professionals. We don't have doctors on staff. We don't have psychologists. We don't have counselors. All our staff consists of people who have lived experience with mental health and substance abuse. So that is essentially what a peer-run center is.
Okay, so now I guess following up on that, what exactly is it that you do there, or what would an experience look like for someone coming in there and receiving peer resources?
So we do a lot. Just on the basic level, the very basic level, we have breakfast and lunch 7 days a week. We offer showers. Georgetown has laundry, Seaford does not. We have computers for job search, housing search. We do groups, or we like to call them engagement activities because nobody likes the group word. We do budgeting. We have a women's group. We have a men's group. We have like an interactive board where there's just a different question every day. That way we can just engage with our participants. If people come in and they need general health, eye, doctor, mental health, substance abuse, we do referrals for that. Pretty much anything that somebody is looking for, we try to find it. The biggest struggle that we do have is the whole housing and homeless. We can do as much as everybody else with, calling the Housing Alliance and being put on shelters and social services, things like that. We help people get Assurance wireless phones. We recently, both centers signed up to do the ASSIST program to help people get their benefits and Medicaid and general assistance. I think that's it for right now. I'm pretty sure I am missing some things, but we just do a little bit of everything.
Yeah, it sounds like that. I was just gonna say, it sounds like you all do a lot of different things there, and it sounds like a lot of people can benefit from things going on there. Wow, thank you for what you do. That's that's really impressive. So I wanted to follow up and ask, how would someone go about accessing these resources?
Okay, and that one's just super easy. Our program is for anybody 18 and over. No minors are allowed on site. They just walk in. They just walk through our door and say, hey, I'd like to become a member here. And we just do a little bit of paperwork to get them in our system, and that is pretty much it. Just to backtrack a little bit, we do help with documents. So if they need a birth certificate or their IDs, we work with another organization that helps with the cost for that, and we're actually starting something that's pretty cool. It's a scholarship program geared towards community inclusion, and that's in the infancy stage, but we're super excited about that one too. So we're just we're doing big things. It's just a little bit at a time.
Wow. Okay. Yeah. So it sounds like again, very resourceful, and a lot of people that are even just trying to get on their feet, it sounds like, and benefit from a lot of the services you all have there at the A Center. So is there anything else you'd like to add, or you think people might need to know or find useful?
No, I mean, most of what we have, we are pretty much, everything we have is donated. Very little, you know, it's with the community that we're even able to exist, really. And thank you guys for all that you do as well, but that's about it.
Oh, of course, it takes a village, right?
Definitely.
Thank you, Bonnie.
Thank you.
All right. Well, I'm gonna hand it over to Jackie here. She's gonna take over and speak to the remaining panelists here. So here goes Jackie.
Thank you, Estevan. So now we're going to be having Mikhail Wint from the Bridge Clinic. Mikhail, if you would like to introduce yourself and just share a little bit about what you do.
Yes, my name is Mikhail Wint, as she said, from the Bridge Clinic. I'm the site manager for Sussex County Bridge Clinic. The Bridge Clinic as a whole, it's 4 sites currently, and we're a large referral clinic who also serves to bridge the community with pretty much anything they need, whether it's just medication, whether it's just resources. We seek to get them where they need without them having to pretty much run around and try to figure it out, you know.
And quick question, where are your 4 locations?
So we have, my site, which is Sussex County, we are located in Georgetown, and we have the Bridge Clinic Hope Center, which is, you know, for those who don't know, the new, I guess the hotel they changed into a large building that services pretty much multiple agencies at once. Then there's the original site, Bridge Newcastle, which is around the corner from DPC, and there's Bridge Kent County, which is located in Dover.
Okay, awesome. So that's a good thing to know, just to know where you're located, where they could go to look for you. And so a question for you. Can you share with us the process of screening and deciding on what referrals to make? So when you have a client, how does that process start? What does it look like? What type of system is it?
So here at the Bridge Clinic, we've made the entire process very streamlined and easy. What we like to do, so most times you'll call in and you'll be greeted by an admin, takes basic demographics. And usually from there, you're able to speak to a peer or one of our social workers. So generally speaking, we try to get you in, get an appointment within 24 to 48 hours. Most times when you hear any type of services, you're like, hey, I might have to wait a week or wait an obscene amount of time. For most of our clients or patients, it's more immediate than that. So once you see a peer or a social worker, we use a variety of behavioral health and substance abuse tools to kind of help us dig deeper and to figure out, what services we can offer you, and if there's anything you can actually utilize that would be of some level of support. So once we figure out what you need, we reach out to the community and actually, for the most part, schedule you appointments. So we'll be the person to call, AMF, or Addiction Medical Facility, and call, like, hey, we have a client who needs an appointment. We would be the person versus relying on you to do that. You can imagine a lot of times, someone tells us, hey, call this person, make an appointment, and then we push that off, when we get the time to do it. So we take all of that out. But we definitely try to do that for every single patient, and regardless of what your needs are.
That's really, I know I personally appreciate that a lot, because sometimes it's easy to say, well, just call this number, and they might never call that number. Mm-hmm. And so it sounds like at the Bridge Clinic, they're definitely, we're going to get you that appointment. You know what I mean? We're going to help you get that appointment. And so what are the major, you're referring, like, what are the big agencies that you typically, like, that's the agencies you're usually referring to? Or you
I can't specify any particular agency. We literally utilize all resources within the community.
Awesome.
So both the private, so let's say if you're coming to us for substance abuse related issues, we won't just use your larger, your adult behaviorals, your son behaviorals. We're going to use all the smaller entities as well, because once again, time is of the essence. So we can get you an appointment at a suitable place that meets your needs. We're going to go to that place.
Great. That's good. That's good. I know one of the referring, a lot of people need help with housing, but with housing comes barriers. And I know that one of our speakers mentioned that before. Could you share a little bit about that, about how you guys assist with housing, but also maybe mention about the barriers of finding housing?
Okay. Truthfully, we run into the same barriers as most entities. There's not a lot of housing, especially in Sussex County. So we do typically refer, individuals to the Housing Alliance. Few years ago, it was easier you just called a particular place that, hey, do you have beds? Do you have availability? But most agencies, most houses have moved to using the Housing Alliance. But we also utilize Mommy and Me houses, Oxford houses, and anything within our network. We will call another place like, hey, you don't have beds, you don't have access. Do you know any place who does? But we definitely run into the same thing. Our biggest barrier, or at least I would say hardest to place, is for instance, like sex offenders. We have found some housing for them, but it is extremely difficult.
Right, yeah. Well, thank you for sharing that. One last question. How would someone access your services? Do they just walk in, or is it over the phone appointments?
At this time, we are doing primarily over the phone. So someone could just call in. Even if you're not sure of your particular county's contact information, you could call. For instance, I can leave my number, 302-515-3310, and we would provide you with information for that particular county you're in. There are certain, so for instance, Bridge Clinic Hope Center, because of their location, they do deal primarily with residents of the Hope Center. However, they do help individuals within the community. Bridge Newcastle, they do take walk-ins, but primarily they are still over the phone.
Okay, yeah, and that's due to COVID, or was that even before?
That's due to COVID.
It was due to COVID.
So
well, I can verify to everyone here that Mikhail picks up his phone. If he gave you his phone number, he will pick up the phone. Every time I call him, he always answers. I've never left a voicemail. He always picks up. So thank you. Is there anything else that just from the small conversation we just had that you would like to share?
So I think one of the things that I guess the biggest thing that I left out is as far as what it looks like for us to bridge services. One of the key parts to the Bridge Clinic is the mental health and substance abuse side of it. Unfortunately, we do not administer any MATs. However, we do have, and each site has access to psychiatrists or residents and nurse practitioners that we can provide mental health medication. They either go through normal channels, pharmacies, or we are able to use the state pharmacy. Fortunately, we do not administer narcotics or addictive forming, so no Xanax, no things like that, no Klonopin. But we do give you and provide you, with, let's say 30 days worth of medications that could assist with whatever's going on until your appointment that we've set.
Okay, thank you for sharing that. That's really important information. And we'll be back with you a little bit later if there's anything else that you want to share with us. Thank you, Mikhail.
Thank you.
Now, Aaron Willis is here with us from Sun Behavioral as well. Aaron, would you like to share a little bit about yourself and what you do at Sun Behavioral?
Yeah, so I am not clinical like a lot of the rest of them. I am the Director of Business Development. I have been in the field for going on around 10 years. So I have a lot of community liaison work, but I definitely enjoy what I do every day.
Awesome, thank you. Community, that's where it starts, right? That's how we get,
yes.
That's how we get people to come in and learn about these resources. So those roles are just so important. And so to ask you a little bit about some behavioral, I'm sorry. Hospitalization can be intimidating experience for everyone involved, for the person and for the family. Can you share with us a little bit about what that experience would be like at some behavioral?
Sure. So we knew before COVID, I mean, everybody knows that it's kind of traumatic experience to basically surrender yourself or to realize you have a problem either with mental health or addiction. And so we were already moving to a virtual assessment. However, COVID kind of expedited that. So one of the things I think is helpful is people can go to our website and do a virtual assessment, the same as it would be to walk into our building. And so that kind of helps alleviate some of the anxiety for people, so they can do the assessment and see if they're going to be inpatient, and then we can get them here. But so beginning, when you walk into our building, we don't want it to be or feel institutionalized. It's very open, it's bright, we have a lot of windows. And so when you come in, you are immediately taken back to our intake department and you're met with all master level clinicians. They perform your assessment. And then if you meet inpatient criteria, you will be taken to the unit. The unit, again, it's very open. It's not institutionalized. Our SUN is a trauma-informed care-based model we use. So you have a lot of people who have shared experiences or lived experiences. So you're with people who are experiencing similar things that you're going through. So it kind of has your own peer support on the unit with you. We have counselors, we have licensed therapists, we have nurses. So we have a whole bunch of trained staff who are here to help you. As far as family goes, due to COVID, we kind of don't have in-person visitation right now, but we do allow Zoom sessions. So anytime during your treatment, if you want your family, if you want to see your family, anybody can just ask one of the nurses and we can schedule a Zoom session with your family. So we try to eliminate as many barriers as we can. Something that's also important is we never want the patient to feel like they're not involved with their treatment. And so we allow them to sit in on their own treatment team to discuss, this is how you were on day 1, here's where we're at day 4. Let's talk about your aftercare. What do you want out of this? So we try and keep them as involved as possible during their stay.
Oh, I really like that.
Yep.
I think that probably makes them feel even more empowered of what's the next step for their treatment and things like that. And one of the things that you mentioned of barriers is leaving family, maybe. Let's say for parents, leaving my children and not being able to talk to them. And so it sounds like you guys have Zoom now, which is amazing. And what about over the phone? Do they have access to their phone? This would be my question if I was going in. Will I have my phone with me?
Right. So actually, that's a touchy subject. We're working on trying to figure out a way to allow cell phones, but being that we have to stay HIPAA compliant and we don't want people catching videos of someone or taking pictures of someone, because we really try and stay confidential. Right now, they do have access to a phone on the unit, like at like the nurse's station or on the unit that they can use. However, like some people didn't grow up without a cell phone. So it's hard for people to remember numbers. Like I only know like a certain amount of phone numbers. So if you wanted to call like your friend or somebody, you can go to the nurse's station. They could get out your phone for you, get the phone number and tell you so you can call. But we're trying to work on a way to potentially allow other ways to communicate, to use the wall phone.
And as you mentioned with HIPAA, that can be difficult for families to communicate.
Yes.
So what does it look like for a family member to want to get in contact with son, daughter, or spouse, cousin, sister?
Yeah, so for when they're here, they get a individualized PIN number. It's like a 4-digit PIN that they could give out to friends, family. And so when someone's calling in, they get our receptionist or a nurse and they'll say, I want to talk to Aaron Willis. The receptionist will then say, do you have the 4-digit PIN? As long as they have that 4-digit PIN, they'll pass it through the unit and they'll be able to get connected with them. If they don't have the PIN, what I always encourage is that they go ahead, the receptionist will say, unfortunately, I can't confirm or deny that patient is here. However, if you want to leave your name and number, we can pass the message if they are here. So either way, we try our best to make sure that we get people connected.
See, that already makes me feel at ease. You know, there's a way, because that would be, you know, that's something that can, you know, stay communicated to family or children or spouse. So that would make me feel at ease. So I'm hoping this information will help someone and say like, okay, I'm still in control. I'm in control of my treatment. I'll be able to be a part of that. I'll be able to be still part of my home to an extent, of course.
Yeah.
And another question. So there are often misconceptions about behavioral agencies only being inpatient. So what different level of cares do you have there at Sun Behavioral with outpatient services?
So right now we have our inpatient, and then our step down would be partial hospitalization, or PHP as some would know. And that is 5 days a week, around 6 hours a day. You're basically receiving the same group therapy treatment that you would on an inpatient level. You just get to go home at night. So it kind of helps you kind of get reacclimated to being at home. And then a step down from that is our intensive outpatient, which is 3 to 4 times a week, and it's roughly 3 hours a day. And so we have a daytime program, and then we just started offering an evening program, which allows those who may be going back to work and they need to be able to still get treatment at home. It's 100% virtual. So it's just been really helpful for us to meet more needs of the community.
Okay, is there anything else that you would like to share with us in regards to this conversation?
Well, I could talk for hours on
okay.
just as everybody else, I'm sure, in Sussex County.
Violet to east. Violet to east.
So we have, that is one of the barriers we have is, of course, housing, because we get people all the time who are coming here and they have nowhere else to go after us. And so, you know, we work very closely with the Housing Alliance and DSAM and the Bridge Clinic. We work with everybody here. RED, we all try and work together to help people get to where they need to be. But housing is definitely a hot topic, I'm sure, for all of us.
Yeah, well, thank you. And please, if there's anything else you want to add, we're gonna come back to you. If you'd like to share anything else that we're forgetting. So as we know, our main purpose here with NAMI was that we wanted to talk about what is in Sussex County, right? There's always that question of, you know, people say there's nothing in Sussex County, and that's just not true. We're just sometimes not aware of what is near us and what we can access. And so we've asked each of these agencies, we're giving them a couple of minutes for them to share just maybe what's going on in their agency, if they have an event coming up, or any information that would be important that maybe the community is just not aware of. So again, we're going to start with our first person, who was John from the Red. If you would like, if there's just anything going on at the Red, any sort of events, we'd love to hear about it.
Yeah, we're currently celebrating, like I said earlier, our 20-year anniversary. So we have been having some events. We did have one of the senators here yesterday, and that I did see it in the news, talking about grants for us to improve the way we communicate with our patients, both through email and through text. You know, one thing that we do here is that we remind our clients of their appointments to help with them missing it and, you know, having to be hospitalized or having something happen to them. So that is definitely a big one. We also heard a lot of people talk about housing. We do have a homeless case manager that does help our mental health patients that have housing issues, and also our primary care patients. We're working in a grant that integrates our behavioral health with our primary care and dental as well. So those are just some of a few things that we've been doing here at Lored.
Thank you. Thank you. I appreciate you adding that. And now Janet from Addiction Medical Facility, if you would like to, I'm catching you. If you would like to share anything that you forgot that is super important that people should know about.
Okay, so I would like to share with you all that we are trying to change the face of methadone clinics here at Addiction Medical Facility. In my experience, the methadone client has been kind of the redheaded stepchild of the treatment system. They are the only group of folks with a chronic illness that have to show up somewhere every day to get their medication, as opposed to going to a pharmacy like everybody else with any kind of chronic illness. So we're really trying to change that whole stigma, circumstance, and just in general, how these clients are treated on a regular basis. It's a very interesting system. To some degree can be fairly punitive. It's like, you know, if you don't do what we tell you, we're taking your medication away. And I don't know where else that might happen in any kind of mental health or any kind of treatment setting. So we are working to change the face of the clinic. Hope we'll be able to be successful at that. I had a man come in today who transferred here from somewhere else. He'd been somewhere else for 6 years. And I was out in the lobby and he said, I've been going to a clinic for 6 years, never met the director. And he said, I haven't been here for 20 minutes and I met you. So it's those types of things. You know, the staffs are pretty insular and we're just trying to really change the face and reach out to folks. And
I thank you for adding that because it's true. And I know.
Thank you, Jackie, for saying
that. I think that that's something that NAMI, when we're doing presentations and stuff like that, one of the big conversations is stigma. Is why are people being treated differently than someone who has cancer? You know what I mean? And so I'm sure people are going to appreciate that. Maybe they're going to feel even more comfortable to go to your agency and say, hey, I'm gonna get good treatment, and they're going to be understanding and they're going to be kind. And so I appreciate you.
I hope so. And I would invite any of you. Some of you have already been to visit us. Estevan is on our board of directors, our community advisory board. Some of the other folks on have been here, but I would invite any of you to come and visit the clinic and just see some of the things that we're doing a little bit differently.
Well, I'm going to take that. I'm going to take that invite because I have not gone.
Well, I need to get you and Estevan back anyway to talk about NAMI. So Wesley was here yesterday with another group from Camp Rehoboth, but when he was telling us some NAMI stuff, I said, I need you guys to come and talk to us. So
we would love to. Thank you so much.
I look forward to it.
Thank you. And now Bonnie from the ACE Center. If you would like to add something that you missed.
Yeah, actually, I was sitting here, I'm like, wait, I missed this and I missed this and
This is why we got those last minute so that we could just remember, oh, okay, I need to tell them this also.
Right. I'm not sure if we have any specific events coming up. I know we did have COVID-19 vaccines, the second go around yesterday. So we do specific events. Trish would be better to able to answer that question. But we also, we partner with Camp Rehoboth. They go to the Georgetown location once a week. They come here to Seaford twice a month for HIV testing, pregnancy testing. Brandywine County Counseling Services comes to both sites once a week. We have a clothing closet. So if people need clothes, if we have it, we give it. Same thing with the shower, shampoo, lotion, everything that our participants could possibly need. If we have it, we give it. We have a phone specifically for our peers if they don't have a phone, and it has its own phone number, and they're able to utilize that if they need to get a hold of somebody or if they need somebody to call them. We have several of our staff at both locations that are trained to we're training the trainer to train people on naloxone, on Narcan, and we do give those kits out as well. We have Wi-Fi. We have a Zoom room. Now, that was the last thing that we started doing with COVID in the world that we live in today. So both sites have a Zoom room, and it's essentially just that. It's a computer, speaker, video, and it could be, educational. They could be doing religious, going to churches because they're not able to get out. NA meetings, AA meetings, leisure. So that was one of the newer things that we implemented in both centers, and that was pretty cool too. I think that was it.
See, those are all the small things that are so important though, right?
Yeah.
There is an agency out there that could offer me shampoo, somehow to get on a computer, somehow to talk on the phone. Like, these are the small things that people don't know about. So thank you.
Yes. Yes.
And now, Mikhail from the Bridge Clinic, if you forgot anything, we'd love to hear you.
Yes, Jackie, I did forget something. I don't know how I forgot it, but we also have a mobile bridge clinic. Most people have seen it driving through the community throughout the entire span of Delaware. We usually partner up with the Food Bank of Delaware, and just post up in the community and give out PPE, naloxone. We usually have at least one licensed therapist there as well, to provide some brief counseling if needed and to help reduce resources. This coming Friday, we will actually be at the Meadow Bridge Apartments down in Seaford, handing out food, obviously food bank. So tons of food, as well as the PPE and naloxone and things like that. These are things that we do almost every week throughout the state. So at any time, if anyone ever wants to volunteer, or if you actually just need the help and assistance, just look for us or just give me a call and I'll be able to get you in touch with who you need to be in touch with.
How would they know where you are at the different weeks? Like, is there something online? Or just right call you?
Yeah, they can just call me.
Okay, see, he picks up the phone, I'm telling you.
Yeah, right now they can just call me. We're trying to figure out how to get it more widespread. But we usually hand out flyers or announce it at a particular event, like, hey, we'll be here at the next event. But if they call me, I'll be able to tell them, at that point, this is where we'll be and what time. Okay. Mm-hmm. Perfect. Now, the event starts at 11 o'clock. It's better to get there early than late.
Yes, you always get the best if you're in the first line.
Yep.
Anything else you'd like to add?
No, ma'am.
All right. Thank you, Mikhail.
Thank you.
And now, again, we have Erin Willis.
I mean, there's a lot I could talk about. I think the biggest thing is we do partner and we work with the Sussex County and Kent County community response teams in Delaware. And so last week we held a point of distribution, our Narcan event, which we had it at Sun, and we train people and we give them free Narcan. We plan to have another event on May 21st in Rehoboth, so we can kind of hit all of the restaurants and hotels that are down there before Memorial Day. So teaching them how to recognize an overdose and what to do and how to save a life. So we are big advocates on that. We are big advocates on prevention as much as we can, or what we can do. So I think that's the biggest thing. And then also our evening IOP, that's our newest program. It's 100% virtual, and anybody can just go online at sundelaware.com and read all about it and get started.
Great, thank you. Thank you so much. Well, I want to thank everyone who was here with us today. You guys are amazing, and what you do is amazing. Our main goal here is that someone who needs this information or who has been afraid to take the next step, or just needs that push of confidence, that they could get that. And of course, knowing what is in our community, because there's so much. Just here alone, there's a wealth of resources. And so I'm so glad that you guys do what you do. So we're going to go ahead and end the recording. Thank you all for being with us today. We're going to end recording.